This is All India Radio. We now bring you a special news program on COVID-19. Good evening. I am VC Pramod and with me is Renuka. The headlines. Government says recovery rate of COVID-19 in the country is 17.47%. No fresh cases reported from 61 districts in 23 states and UTs in the last 14 days. 6 interministerial central teams visit Maharashtra, Rajasthan, Madhya Pradesh and West Bengal to review implementation of lockdown measures. India was the first country in the world to respond to China's first disclosure about novel coronavirus, says Health Minister Dr. Harshvardhan. An interactive platform, COVID India Seva, launched to provide real-time solutions to COVID-19 related queries. And Union Minister Mukhtar Abbas Naqvi says all Muslim religious leaders, organizations and community have decided to offer prayers during Ramzan inside their homes. The recovery rate of COVID-19 patients in the country is 17.47%. Briefing media in New Delhi today, Health Ministry spokesperson said, currently there are 61 districts in 23 states and UTs where no fresh cases have been reported in the last 14 days.
3 डिस्ट्रिक्ट थे जिस पर पिछले 28 दिनों से केसेस नहीं आए हैं, उसमें एक और नया जिला अब प्रतापगढ़ राजस्थान ऐड हुआ है. इसके साथ ही टोटल 61 डिस्ट्रिक्ट्स हैं देश में 23 स्टेट्स और यूनियन टेरिटरीज में, जहां पिछले 14 दिनों से कोई केस नहीं आया है.
According to Health Ministry, 18,985 positive cases of COVID-19 have been reported across the country so far. As many as 3,260 patients have recovered and have been discharged from the hospitals, while 603 patients have died. The spokesperson said the centre has issued detailed guidelines to all states that while focusing on COVID-19, all other services need to be provided, be it for dialysis, HIV, cancer and other treatments. He also said Indian Red Cross has started a round-the-clock control room for blood services in Delhi. The Home Ministry spokesperson said an SOP regarding movement of stranded labourers within a state was shared with states so that labourers at shelters and relief camps could participate in permitted activities. She said the Home Ministry is working with states and monitoring the enforcement of lockdown rules. She said the interministerial central teams are not getting support from West Bengal government in Kolkata and Jalpaiguri as they are not being allowed to visit the areas and interact with health workers.
गृह मंत्रालय राज्य सरकारों के साथ मिलकर लॉकडाउन नियमों के सख्ती से अनुपालन को निरंतर मॉनिटर कर रही है. केंद्र सरकार ने हेल्थ एवं मेडिकल इंफ्रास्ट्रक्चर और आपदा प्रबंधन के मुद्दों इत्यादि पर राज्य सरकारों की सहायता के लिए इंटर मिनिस्टीरियल सेंट्रल टीमों का गठन किया है. 4 राज्यों में इन टीमों को भेजा भी गया है. इन टीमों में वरिष्ठ स्तर के प्रशासनिक अधिकारी हैं. एडिशनल सेक्रेटरी टू गवर्नमेंट ऑफ इंडिया इस टीम को लीड कर रहे हैं.
Indian Council of Medical Research spokesperson informed that over 4.49 lakh tests for COVID-19 have been conducted so far in India. He said states have been advised not to use new rapid antibody tests for 2 days, adding that it will investigate issue of faulty kits. On the occasion, the chairman of the 4th Empowered Group tasked with augmenting human resources and capacity building for COVID-19 informed that COVID Warriors .gov.in has been created as a master database of healthcare professionals and volunteers. Till now, details of 1.24 crore human resources of various kinds have been added to it. He said the details of Corona Warriors in 20 categories and 49 subcategories who can contribute to COVID-19 management efforts are available to states and union territories on the portal. He said the Corona Warriors volunteers are involved in the preventive activities like social distancing, supply of essential commodities in containment zones and field surveillance. He also said 15,000 Ayush professionals have been deployed in 17 states and UTs in management of COVID-19. Besides, over 1 lakh Ayush professionals and 55,000 Ayush students have been trained and ready for deployment. 6 interministerial central teams are visiting Maharashtra, Rajasthan, Madhya Pradesh and West Bengal to make an on-the-spot assessment of the compliance and implementation of lockdown measures in the wake of COVID-19. These measures are as per the guidelines issued under the Disaster Management Act 2005. The team has public health specialists and officers of the National Disaster Management Authority, NDMA, who can lend their expertise to the state government for management of the COVID-19 epidemic. The IMCT's focus is on issues like the supply of essential commodities, social distancing, preparedness of health infrastructure and hospital facility. They will also look into aspects like sample statistics in the district, safety of health professionals, availability of test kits, PPEs, masks and other safety equipment, and conditions of the relief camps for labour and poor people. Centre has directed West Bengal government to comply with its orders and not to obstruct working of interministerial central teams visiting the state to review an on-the-spot assessment of implementation of lockdown measures to fight COVID-19. In a letter to State Chief Secretary, Home Secretary Ajay Bhalla said the West Bengal government is not cooperating with central teams to assess COVID-19 situation and teams specifically restrained from making visits, interacting with health workers and assessing ground situation. He said this amounts to obstructing the orders issued by the centre under the Disaster Management Act 2005. Mr. Bhalla directed the state to comply with the orders and make arrangements for interministerial central teams to carry out their responsibilities. Meanwhile, the West Bengal government has said that it will extend all kinds of support to the visiting central teams in the state. Giving this information in Kolkata this evening, State Chief Secretary Rajiv Sinha said that he met the members of the central team in Kolkata twice and assured all kinds of help. He also informed that the team visited corona-hit areas of the state today. Our correspondent has filed this report.
The central team, led by Apurva Chandra, Additional Secretary of Defence Ministry, visited some areas in Kolkata to review the situation. The team is scheduled to visit various hotspot areas in Kolkata, Howrah, North 24 Parganas and East Midnapur districts, while another team headed by Vinit Joshi, Additional Secretary, Human Resource Development Ministry, is stationed at North Bengal, scheduled to visit Darjeeling, Kalimpong and Jalpaiguri districts to take stock of the situation. Union Home Ministry deputed two fact-finding teams to West Bengal to examine the ground reality on adherence of lockdown in the state to fight against COVID-19. In fact, the Home Ministry expressed serious concern over violation of lockdown norms in the state, which may lead spreading of the dreaded disease. Arijit Chakraborty, AIR News, Kolkata.
3 more corona-related deaths have been reported in the state in the last 24 hours, taking the death toll to 15. Besides, 29 corona-positive cases have been reported, taking the total number of positive cases to 274 so far. In Madhya Pradesh, on the second day of visit, a team of central officials was instructed Indore local administration to strictly implement the lockdown measures. The team reached Indore yesterday to review the situation caused by the spread of coronavirus infection. A report.
The 5-member team is headed by Additional Secretary level officer. District Administration official informed that the central team has emphasized the need for coordinated efforts by various departments to deal with the outbreak of coronavirus in the district. The central team visited the various field areas in Indore and expressed satisfaction over the arrangements made by the Indore administration. Sanjeev Sharma, AIR News, Bhopal.
Health Minister Dr. Harshvardhan has said that India was the first country in the world to respond to China's first disclosure about coronavirus to the world. He said on the next day, India initiated steps to monitor the situation and first joint monitoring group meeting was held. A group of ministers was also constituted by Prime Minister Narendra Modi to take important decisions as per the evolving situation. He said this was enough to set the tone for a highly spirited war against fatal viruses across the country. Interacting with the Rotarians across the country through video conferencing, Dr. Harshvardhan said the world has been acknowledging the fact that India is placed much better than other countries in her fight against coronavirus. The minister conveyed thanks to the Rotarians for contributing an amount of 26 crore rupees in the PM CARES Fund. He appealed to people not to believe rumour, mongering and misinformation being spread by vested and irresponsible interests. Dr. Harshvardhan today launched an interactive platform, COVID India Seva, aimed at providing real-time solutions to COVID-19 related queries. People can post their queries to the COVID India Seva Twitter handle for getting swift replies from the team of trained experts. This initiative is aimed at enabling transparent e-governance delivery at large scales, especially in crisis situations like the ongoing COVID-19 pandemic. The Health Minister in a tweet said that through this platform, trained experts will be able to share authoritative public health information swiftly at scale, helping to build a direct channel for communication with citizens. Commenting on the launch of the social handle, he said that Twitter has proved to be an essential service for both the government and citizens to interact and exchange information, especially in times of need. The responses by the experts will be available for everyone, and users will not be required to share any personal details or health records on this account. In the fight against COVID-19, technology has come to our help. Ministry of Electronics and Information Technology, along with the best tech brains in the country, developed the Arogya Setu app, which has been downloaded by nearly 7 crore people in just 18 days since its launch. The app works on radio signal technique and sends alerts in case its user comes in contact with any corona-positive person. Details from our correspondent.
By downloading and installing Arogya Setu app in your Android as well as iOS phones in just 30 seconds, you can ensure the safety of your family and yourself from COVID-19. This app sends you alert in case you come in contact with any COVID-positive person. Even if the person you met 14 days ago develops corona infection, you still get the alert to take necessary precautions. This way, you can make yourself and your family safe from contracting the infection. On the other hand, through a set of questions on this app, you can also self-analyze your health status anytime. Prime Minister Narendra Modi has urged people on a number of occasions to download this app.
कोरोना संक्रमण का फैलाव रोकने में मदद करने के लिए आरोग्य सेतु मोबाइल ऐप जरूर डाउनलोड करें। दूसरों को भी इस ऐप को डाउनलोड करने के लिए प्रेरित करें।
Speaking about Arogya Setu, Secretary, Ministry of Electronics and Information Technology, Ajay Sahni said,
if this app is downloaded by each one of us who carries a smartphone, then it is possible for us to generate alerts, early alerts, alert that might reach you even before you realize that you have a possibility of getting infected. In case, God forbid, you actually have the disease and you need hospitalization, then connect you with hospitalization service providers as well.
For better results, it is necessary that maximum number of people download Arogya Setu on their smartphones. We at AIR News have downloaded Arogya Setu and request you and your near and dear ones to download it now and stay safe. Stay home and stay tuned with AIR News for the latest. Anand Chaturvedi, AIR News, Delhi.
Lok Sabha Speaker Om Birla today said that both central and state governments have been vigilant with COVID-19 pandemic and have taken necessary steps to contain its spread. He said mutual synergy and excellent disaster management efforts have allowed India to minimize the damage from the disease. He was interacting with presiding officers to state legislative assemblies via video conferencing at Parliament House. Mr. Birla urged state assemblies to explore the possibility of extensive use of digital technology in legislative and financial work and for other routine tasks to maintain social distancing and other requirements specified in the guidelines to tackle the pandemic. 28 presiding officers attended the conference. Mr. Birla said that wherever possible, India has tried to help other countries by supplying medicines and other essential equipment, living up to the ancient Indian philosophy of Vasudhaiva Kutumbakam. The Ministry of Tribal Affairs has taken up various proactive measures for implementation as part of the process to save tribal persons from pandemic COVID-19 and to restore growth in the economy after the resultant movement restrictions. A report.
Union Tribal Affairs Minister has written letters to Chief Ministers of 15 states to sensitize their state nodal agencies for undertaking procurement of minor forest produce at minimum support price in right earnest. 3 teams of officers have been constituted by the ministry to prepare the roadmap and take necessary measures for implementation and realization of each of the initiatives to restore growth in economy after the COVID-19 pandemic. The Ministry of Home Affairs has issued guidelines aiming to relax the provisions of lockdown for collection, harvesting and processing of minor forest produce and non-timber forest produce by scheduled tribes and other forest dwellers in forest areas across the country. Regarding Ekalavya Model Residential Schools and Ekalavya Model Day Boarding Schools, the ministry has directed the states to shut all the schools by rescheduling the holidays in these schools till 25th May. The ministry has advised the state governments and Union Territory administration to ensure that tribal areas and tribal population are adequately covered by taking all measures. Anupam Mishra, AI News, Delhi.
Shailesh Kataria, a farmer from Surendranagar district in Gujarat, thanks the government for reopening the procurement in APMCs and various other farmer-centric decisions during the lockdown.
यहाँ वढवाण एपीएमसी में गेहूं लेके आया था। जो सरकार ने इस लॉकडाउन में जो शुरुआत की है उसका मैं सरकार का खूब खूब आभारी हूँ। जो इस मुश्किल में सरकार ने खेडूत को सहाय की है उसका मैं आभार मानता हूँ सरकार का। और यहाँ सोशल डिस्टेंसिंग से काम बिल्कुल बराबर है।
Jayanti Patel, the owner of Fair Price Shop in Valsad district of Gujarat, calls the decision of distributing free ration to both BPL and APL ration card holders a good step to ensure food security during lockdown.
हमारे यहाँ सरकार ने जो एनएसएफ और नॉन एनएसएफ को मुफ्त में अनाज दिया है, गेहूं, चावल और चना दाल खान, वो बहुत ही अच्छा काम किया है। और सरकार ने जो ये फैसला किया है हमारे गांव के गरीब लोगों को और सभी कोरोना वायरस की वजह से फंसे लोगों को बहुत ही फायदा हुआ है।
Neil Maheta from Sabarkantha appreciates the initiatives taken by the government to fight COVID-19, appeals everyone to install Arogya Setu app to tackle the pandemic.
भारत सरकार ने आरोग्य सेतु नाम की एप्लीकेशन बनाई है जो मैंने डाउनलोड की है और मैं अपने परिवारजनों, मेरे आसपास के रहने वाले सभी लोगों को वो एप्लीकेशन डाउनलोड करने की अपील कर रहा हूँ। मैंने जो मेरे ग्रुप सर्कल्स हैं उनमें भी लोगों को बताया कि वो भी डाउनलोड करें और बहुत लोगों ने तो डाउनलोड भी कर ली है। तो मैं आप सबसे निवेदन करता हूँ, कोरोना महामारी से लड़ने के लिए आप लोग भी आरोग्य सेतु नाम की एप्लीकेशन अभी डाउनलोड करें।
This is All India Radio, bringing you a special program on COVID-19. A reminder of the headlines before we move on. Government says recovery rate of COVID-19 in the country is 17.47%. No fresh cases reported from 61 districts in 23 states and UTs in last 14 days. 6 inter-ministerial central teams visit Maharashtra, Rajasthan, Madhya Pradesh and West Bengal to review implementation of lockdown measures. India was the first country in the world to respond to China's first disclosure about novel coronavirus, says Health Minister Dr. Harsh Vardhan. An interactive platform, COVID India Seva, launched to provide real-time solutions to COVID-19 related queries. And Union Minister Mukhtar Abbas Naqvi says all Muslim religious leaders, organizations and community have decided to offer prayers during Ramzan inside their homes. For quick news updates round the clock, follow us on our Twitter handle @AIR News Alerts.
Minority Affairs Minister Mukhtar Abbas Naqvi has said all the Muslim religious leaders, imams, religious and social organizations and the Muslim community have jointly decided to offer prayers and perform other religious rituals during the holy month of Ramadan, staying inside their homes. Speaking to media in New Delhi today, Mr. Naqvi urged people to cooperate with health workers, security forces, administrative officers and sanitation workers. He said secularism and harmony is not political fashion, but it is perfect passion for India and the Indians. Mr. Naqvi said this inclusive culture and commitment has united the country with the fabric of unity in diversity. He stressed that constitutional, social and religious rights of all the citizens, including the minorities in India's constitutional and moral guarantee.
130 करोड़ लोगों की आंखों में खुशी और उनकी जिंदगी में खुशहाली आए, इसके लिए बात करते हैं। अगर ये किसी को नहीं दिख रहा है तो ये उनकी अपनी समस्या है। हिंदुस्तान का मुसलमान, हिंदुस्तान का अल्पसंख्यक, हिंदुस्तान के समाज का सभी वर्ग खुश है और वो उस खुशहाली के साथ अपनी जिंदगी को आगे बढ़ा रहा है। और जो लोग इस तरह के माहौल को खराब करने की कोशिश कर रहे हैं वो किसी भी तौर से हिंदुस्तान के मुसलमानों के दोस्त नहीं हो सकते।
The minister said, under the leadership of Prime Minister Narendra Modi, the entire country is united in its fight against the coronavirus by breaking all barriers of caste, religion and region. Delhi Lieutenant Governor Anil Baijal today had interaction with Chief Minister Arvind Kejriwal, Deputy Chief Minister Manish Sisodia and Delhi government's officials through video conferencing. During the interaction, Mr. Baijal reviewed the enforcement of lockdown, testing status, home quarantine, management of containment zones, night shelters and food centers. He advised officials to ensure effective management of containment zones, food centers and night shelters as per the protocols of the Health and Family Welfare Ministry and the Home Affairs Ministry. Briefing a digital press conference, Chief Minister Arvind Kejriwal said that nearly 30 lakh more non-ration card holders will be given free ration in the national capital. 70 lakh ration card holders are already receiving free ration amid nationwide lockdown. Talking about the incidence of media personnel getting infected from COVID-19, he said government will start free COVID-19 testing for media persons from tomorrow and a center has been set up in this regard. In our series Experts Speak on All India Radio, we bring you the views of the leading medical experts on COVID-19. Dr. Sanjeev Bhoy, Emergency Medicine, AIMS, said that if a person has common cough and cold and he has not travelled abroad or not in touch with COVID-19 infected person, then testing is not required.
If you have common cough and cold, and if you are not travelled abroad, or you are not in touch with a person who has come from abroad, or you are not in touch with any patient who has this disease, you do not have to worry, or you do not require any testing. Be at home.
Dr. S. Rajeshwari, Department of Anesthesiology, AIMS, has advised the people to stay at homes and maintain hand hygiene.
We have seen that there is a severe shortage of ICU facilities in the most developed of countries. And in order that we do not face the same calamity in our country, it is vital that we do not stress the health system by becoming more sick and bringing more patients. And for this, I urge that you must stay at home and must maintain hand hygiene to reduce the number of patients coming into the hospital.
In an effort to guard against fake news being circulated on various platforms, we bring you a new segment on fact-checking and mythbusters. Government has rejected a report by a web news portal that it has launched a beta version of a soon-to-be-launched video conferencing app. In a tweet, Press Information Bureau clarified that the centre has neither launched nor endorsed any video conferencing application. The News Services Division of All India Radio, in its bilingual live phone-in program today, will bring you a special discussion program on COVID-19. Dr. Nandakumar, Professor of Psychiatry at AIMS, will participate in the discussion. Listeners can ask questions to the experts on toll-free telephone number 1800-115767. You can also ask questions on telephone number 011-2331-4444 and post queries on our Twitter handle at AIR News Alerts by hashtag AskAIR. This can be heard tonight on FM Gold channel and additional frequencies from 9:25 p.m. onwards.
In Tamil Nadu, 178 COVID-19 patients were discharged from hospitals on a single day today, while 76 new cases were reported. The new cases include 55 from Chennai. Some of them are reportedly from the media. The state has so far recorded 1,596 positive cases, though the active cases are 940. One more patient succumbed to the disease today, taking the toll to 18. Here is a report from our correspondent.
The increase in the discharge of patients today has far outnumbered the increase in new cases in the state. The mortality rate is still being maintained at 1.12%, which is considered one of the lowest. The discharge figure is worked out numerically to be about 40% as of now. However, epidemiology experts point out that a day's data may not be an indicator for the future situations. The administration also maintains that its machinery is ever on high alert. Meanwhile, the State Information Technology Minister has appealed to the IT firms in the state to allow their staff to work from home till May 3rd, when the lockdown conditions will be reviewed. As there are reports of several media personnel having contracted the virus, special camps have been organized by the district administrations and the Chennai Corporation to test them for the virus. Jai Singh, AIR News, Chennai.
The Maharashtra government has withdrawn lockdown relaxation permits allotted to businesses across Mumbai and Pune as it became evident that the social distancing norms were being gravely violated. State Chief Secretary Ajoy Mehta today said the complete lockdown will remain in force at these places, adding that e-commerce sites will be allowed to deliver only essential items. More from our Mumbai correspondent.
Even as the two inter-ministerial central teams are on a visit to Mumbai and Pune, which have been badly affected due to the COVID-19, the Maharashtra government has said that it has decided to set up oxygen stations in hospitals dedicated to treat coronavirus patients. With this, each bed in the hospital where COVID-19 patient is being treated will have mask and the necessary equipment to supply oxygen. A directive in this regard has also been given to hospitals by the government. As a preventive measure, the government has also decided to distribute hydroxychloroquine in some parts of Mumbai, but the medicine will not be given to those suffering from heart disease or those who are above 60 years old and less than 15 years of age. The Maharashtra police have decided to give an advance of Rs 1 lakh to its person infected by the coronavirus to help them manage their treatment costs. Meanwhile, in a notification issued today, the Maharashtra government has exempted print media from lockdown. Kunal Shinde, AIR News, Mumbai.
Uttar Pradesh government has decided to move forward with plasma therapy to treat the patients of COVID-19 and will increase pool testing of the samples. Meanwhile, 9 districts of the state have become corona-free, while 1,294 positive cases have been found in 53 districts.
Reviewing the situation of lockdown in state, Chief Minister Yogi Adityanath today said that results of plasma therapy in treatment of COVID-19 patients are positive and asked the officials to move forward on this therapy. He also said that wherever cases of corona positive are in large numbers, there should be pool testing of the samples. Till now, pool testing facility is available at Prayagraj, Agra and Lucknow only. Meanwhile, work on expressways projects has started in state, which includes Bundelkhand, Purvanchal and Gorakhpur Link Expressway. Around 7,500 laborers are working on site of these 3 expressways. CEO of Uttar Pradesh Expressways Industrial Development Authority, Avnish Awasthi, said that health checkup of all the laborers and social distancing while work is being ensured. Government has also ordered that prisoners related to COVID-19 cases must be kept in separate temporary prisons. Sushil Chandra Tiwari, AIR News, Lucknow.
In Union Territory of Jammu and Kashmir, a physically challenged person hailing from Udhampur district has been making efforts to reach out to the needy in the wake of the prevailing coronavirus pandemic. He withdrew all his savings in the preparation of face masks and distributed totally free of cost, inviting appreciation from one and all. More from our Srinagar correspondent.
A 70% Divyang Pawandev Singh of village Sansu in Udhampur district of Jammu and Kashmir is preparing masks to distribute free of cost among the needy people. Divyang pension is the only source of income for this 35-year-old Pawan Singh, who has exhausted all his savings which he had kept in his bank account to purchase cloth for the preparation of masks.
मैंने भी सोचा कि क्यों ना लोगों में मास्क वितरित किए जाएं। आज मैं बैंक गया था, जितना मेरे पास जो बैलेंस में बचा हुआ था मैं वहां से निकलवा के ले आया हूं और उससे मैं जो अभी कपड़ा खरीदूंगा और उससे जितने मास्क बन पाएंगे वो मास्क बना के मैं लोगों में वितरित करूंगा, जो मैं फ्री ऑफ कॉस्ट दे रहा हूं।
So when a Divyang person, despite being poor with limited resources in hand, could contribute for the society, then why can't we? The need of the hour is to introspect and rise to the occasion and serve to the society to the maximum at these difficult times. With Anil Dubey from Udhampur, this is Sunil Kohl for AIR News from Srinagar.
Amidst the coronavirus pandemic, when mankind is struggling to survive Anushka, the tigress at Birsa Munda Zoo, Ormanji has given birth to 3 healthy cubs today in Ranchi. Earlier, the tigress had also given birth to 3 cubs 2 years ago. 2 out of them are alive and healthy. For wildlife lovers' delight, the number of tigers in the zoo has gone up by 10 after the tigress's recent delivery. It is very rare that canines can easily give birth to cubs in a protected atmosphere of wildlife sanctuary or national parks. And now, before we end, the headlines once again. Government says recovery rate of COVID-19 in the country is 17.47%. No fresh cases reported from 61 districts in 23 states and UTs in the last 14 days. 6 interministerial central teams visit Maharashtra, Rajasthan, Madhya Pradesh and West Bengal to review implementation of lockdown measures. India was the first country in the world to respond to China's first disclosure about novel coronavirus, says Health Minister Dr. Harshvardhan. An interactive platform, COVID India Seva, launched to provide real-time solutions to COVID-19 related queries. And Union Minister Mukhtar Abbas Naqvi says all Muslim religious leaders, organizations and community have decided to offer prayers during Ramzan inside their homes. For details of these stories and more, log on to our website www.newsonair.com and News on AIR app. And with that, we end the special news program on COVID-19.